Do you sneeze, itch, get rashes, or feel short of breath after certain food, dust, or medicine? This could be signs of an allergy, and in some cases, allergies can be life-threatening. Hi Healthy Buddies, I'm Dr. Tirta Wijaya. Welcome to my channel where we will discuss various health matters. And today, we will discuss about allergies. What allergies really are, how they happen, how to diagnose them, and how to manage them safely. Allergy is an overreaction of the immune system to a substance that is usually harmless to most people. These substances are called allergens, such as pollen, dust mites, peanuts, seafood, insect sting, certain medications, etc. In people with allergies, the immune system mistakenly identifies these allergens as pathogens and mounts an excessive response, leading to symptoms that can affect the skin, nose, lungs, gut, or even the entire body. If you'd like a basic explanation about our immune system, I've covered that in my previous video, so I will not repeat it here. I will put the link to that video in the description below because immunity and allergy are really closely related. Allergic diseases are increasing worldwide. According to WHO and global epidemiological studies, allergic rhinitis affects hundreds of millions globally. Asthma affects over 260 million people, and food allergies are rising, especially in children. And allergies are now considered a major public health issue, particularly in urban and industrialized environments. There are 4 types of allergy, named type 1, 2, 3, and 4 hypersensitivity reaction accordingly. Most allergic conditions are due to type 1 hypersensitivity or atopy. Here is what happened in type 1 hypersensitivity. On the first exposure, the immune system produces immunoglobulin E or IgE antibodies against the allergen. The IgE then attaches to mast cells and basophils. These are white blood cells. On re-exposure to the same allergens, there are 2 phases of reaction, immediate and late reactions. In the immediate reaction that happens within minutes from the exposure, the allergen binds to pre-formed IgE on pre-sensitized mast cells, triggering their immediate degranulation that release chemicals like histamine, a vasoactive amine, leukotrienes, the powerful lipid signaling molecules derived from arachidonic acid in leukocytes, and tryptase, the marker of mast cell activation. Histamine mostly stored in basophils and mast cells in connective tissues like under our skin, near blood vessels and lymph vessels, nerves, lungs, and intestines. It has various functions in our body with different effects depending on which histamine receptors it binds to. If it binds to H1 receptor, it causes allergic symptoms like itching, or we call it pruritus, expanding of blood vessels or vasodilation that can lead to low blood pressure or hypotension and faster heart rate or tachycardia, swelling, redness, mucus production, airway narrowing or bronchoconstriction, and many other things. H1 receptor also play important roles in sleep-wake cycle, appetite, memory and learning, body temperatures, etc. Activation of H2 receptors, which mainly found in stomach cells, smooth muscle cells, and heart cells, leads to stomach acid secretion, which help with digestion. Then mucus secretion in airways, vascular permeability, increasing vascular permeability, hypotension and tachycardia, and bronchoconstriction. We also have H3 receptors that mainly function as blood-brain barrier and H4 receptors that play important role in the formation of certain blood cells, inflammatory disorders, and autoimmune diseases. But that is for another video. Leukotrienes are the key inflammatory mediators that cause smooth muscle contraction, For example, bronchoconstriction in asthma, mucus production, increased blood vessel permeability, resulting in fluid leakage and edema. Anaphylaxis is the super immediate and severe form of allergy that is life-threatening. In anaphylaxis, our immune system releases a flood of chemicals that can cause sudden blood pressure drop and significant airway narrowing, leading to shock and breathing blockage. The late type 1 hypersensitivity happens within 1 hour after the allergen exposure, where chemokines attract inflammatory cells, causing inflammation and tissue damage. Type 2 hypersensitivity reaction results when antibody binds to cell surface antigens or to a molecule coupled to a cell surface. This surface-bound antigen antibody structure activates cells that participate in antibody-dependent cell-mediated cytotoxicity, causing cellular destruction, where cell is opsonized or coated by antibodies, leading to phagocytosis, activation of complement system, or NK cell killing spree. Then inflammation, where the binding of antibody to cell surfaces activating the complement system, and Fc receptor-mediated inflammation. And 3, cellular dysfunction, where antibodies bind to cell surfaces activating the receptors, causing abnormal blockage or activation of downstream processes. We call type 2 hypersensitivity as antibody-dependent cell-mediated cytotoxic hypersensitivity. Type 3 hypersensitivity reactions cause inflammation in response to circulating antigen-antibody complexes, unlike the surface-bound antigen-antibody structure in type 2 hypersensitivity. These complexes can activate complement system, which attracts neutrophils, which release lysosomal enzymes. Type 3 reactions develop 4 to 10 days after exposure to antigen. Other name of this is immune complex disease. Type 4 hypersensitivity has 2 mechanisms, each involving T cells. The first one is direct cell cytotoxicity by CD8 cytotoxic T cells. The second one is inflammatory reaction, where CD4 T cells recognize antigen and release inflammation-inducing cytokines. Unlike type 1, 2, and 3 hypersensitivity, type 4 hypersensitivity does not involve antibodies, and the reaction is relatively delayed compared to the others. What are the risk factors and causes of allergy? Allergies develop due to a combination of genetic and environmental factors, with heredity being by far the most important. That being said, it is important to emphasize that nobody is born with allergy. All known hypersensitivities, type 1, 2, 3, and 4, are adaptive immune reactions which typically develop after the first month of life. Some can experience allergy in infancy. Some may get it as an adult. There is no single factor that explains the development of allergy. I think it is the combination of several factors, with heredity as the most important one. The common risk factors of allergy include early life environmental exposures, tobacco smoke, including as passive smokers and other air pollution, changes in gut microbiome, and excessive hygiene in early childhood, known as the hygiene hypothesis. Please note the word excessive here. Common allergens include peanuts, shellfish, milk, egg, pollen, dust mites, mold, and drugs like antibiotics or insect stings, latex, perfumes, and many other things. Allergic symptoms vary depending on the organ involved, whether it is localized or systemic, and the severity. We do not have to have all the symptoms when we are suffering from allergy. In atopic dermatitis, an allergic skin condition also called eczema, we can find itching, red or brown patches on the skin that may be harder to see on dark skin, and skin cracking or flaking. In allergic rhinitis, also called hay fever, we can find sneezing, runny or blocked nose, causing dark, bruised-looking circles under the eyes that we call allergic sinus, or itching of the skin, nose, eyes, or roof of mouth. In insect sting allergy, we can find large area of pain and swelling at the sting site, itching or hives all over the body, then warm and reddish skin, wheezing, shortness of breath, or anaphylaxis. I will describe further about anaphylaxis symptoms later. A medicine or food allergy can cause tingling in the mouth, swelling of the lips, tongue, face, ears, throat, or all, stuffy nose, sneezing, or itchy, teary eyes, itchy skin, rash, hives, or all together, abdominal pain, stomach cramps, vomiting or diarrhea, wheezing, shortness of breath, dizziness, low blood pressure, or anaphylaxis. In anaphylaxis, we find very low blood pressure, rapid, weak pulse, severe rash or hives, upset stomach, vomiting or diarrhea, swollen tongue or mouth, severe shortness of breath, chest or throat tightness and difficulty of breathing, dizziness, passing out, or loss of consciousness. Sometimes the patient can feel that the end of life is near, which is not far from truth, as anaphylaxis is life-threatening indeed. This is a true medical emergency. People with anaphylaxis risk must have unexpired, ready-to-use epinephrine or adrenaline shot with them at all times to be injected right away when they are having anaphylaxis, followed by A&E visit right after that. But not all rashes, upset stomach, runny noses, and other symptoms I mentioned just now are allergies. There are many conditions that may look like allergies. For example, food intolerance, like lactose intolerance, viral rashes, non-allergic rhinitis, drug side effects, anxiety or panic attacks, hematologic conditions like psoriasis or rosacea. Which is why proper diagnosis is very important. Diagnosis starts with a detailed history. What symptoms occur? How soon after the exposure? How severe? How often? Sometimes, doctor may ask you to avoid suspected allergens, then carefully reintroduce to see if symptoms recur. This should never be done for high-risk allergens without supervision, especially for patients with history of anaphylaxis. If you completely have no idea on allergens that trigger your allergy, your doctor may ask you to keep a detailed journal of your symptoms and daily exposures to help you recognizing the allergens. Doctor may recommend clinical tests too, but please note that allergy tests may give false negative results because there are simply too many things that can be allergen. Negative results mean that someone is not allergic to the allergens being tested at that particular moment. This person may be allergic to other allergens not being tested or may develop allergy later in life for the same allergens. The most commonly done is skin prick test, where doctor will prick or scratch your skin with a small needle to expose you to small amounts of suspected allergens. Doctor may do intradermal skin test too, where the allergen is injected into your skin instead. This is more often done to check drug allergies in hospital setting. Another way to diagnose allergy is specific IgE blood tests that measure the amount of immunoglobulin E antibody in your blood after being exposed to suspected allergens. Even though these allergy tests might not be accurate, as I mentioned before, Self-diagnosis without testing can be very misleading. Your doctor can only draft a treatment plan for your allergy after the diagnosis of allergy is confirmed, after ruling out non-allergic causes of your symptoms. Allergy management has three main pillars. First, and the most important, is avoiding the triggers. Once identified, avoiding allergens is the most effective strategy. The second one is treatment with medicines. Depending on your allergy, doctor may prescribe you with drugs to turn down your immune system's reaction or lighten your symptoms. The drugs may be antihistamines, intranasal steroids, bronchodilators, or topical steroids, wherever applicable. Please note that these drugs have side effects and must be used as directed by your doctor. The third one is desensitization or allergen immunotherapy. This treatment can help to treat severe allergy or allergies that don't get better with other treatments. In allergen immunotherapy, patients will be gradually exposed to purified allergen extract under medical supervision. These extracts retrain your immune system to get used to them over time and not overreact on their presence in your body anymore. They can be done as injections or as sublingual tablets that dissolve under your tongue many times over several years. Untreated or poorly controlled allergies can lead to complications like chronic sinusitis, poor sleep, and associated conditions like hypertension, insulin resistance, dyslipidemia, etc. Asthma exacerbations, malnutrition from unnecessary food avoidance, psychological stress, and reduced quality of life. Important things to remember if you have a known severe allergy. Always have an unexpired epinephrine or adrenaline auto-injector ready to use anytime you need it. Learn how and when to use it, and inform all healthcare providers about your allergy, and wear medical alert identification, and educate family members and caregivers about your allergy. This can be a matter of life and death. Allergies are common, but they are not trivial. Proper diagnosis and management can be life-changing and life-saving. That is my sharing today about allergy. If you found this video helpful, please like, share, and subscribe. Please feel free to let me know in the comments if you'd like me to cover other topics about health. But please don't consult your specific health issues. Proper consultation must be done personally with your doctor. This is my disclaimer. Thank you for watching and see you in my next videos. Stay healthy and happy.